Good morning, everybody. Thank you very much for tuning in to the Capitalist Cast today. I am joined by Representative Don Keefer. Representative Keefer, I forget what your district number is.
It's a 92nd district, so Northern York, and I have a little piece of Cumberland.
Yeah, so at least for now, I'm sure that will be, that's a whole other topic of discussion as we get into redistricting.
Yep.
But today, I appreciate you coming on. You are the Secretary of the Health Committee in the House of Representatives. There's been a lot of action from the House, or there's been action from the House, I guess is probably a better way to put it, as it relates to the governor's mask and vaccine mandates, as well as some legislation that had previously been vetoed by the governor on vaccine passports. So let's talk a little bit about, why the renewed push to try and rein in the governor's ability to issue these mandates.
So it's our opinion that the Secretary of Health doesn't have the power to issue a universal masking policy. The only way she would be able to do that, she's in the Pennsylvania Disease Prevention and Control Act. It allows her to implement control measures as statute, and it says regulation and rule allow. There is nothing in regulation or rule that allows for universally masking healthy people. And so she would need to go through the regulatory review process in order to implement that. She didn't do that. Now, the only other way that she could do that would be if we were in an emergency declaration, a state of emergency. That gives the governor broad powers to lift statute and regulation, but we're not. And so she does not have the power to do that. And so we sent a letter through the Health Committee. We took action last Tuesday, and issued a letter to the Committee on Documents, asking them to review this policy of the Secretary of Health for legality, because she did not go through the regulatory review process.
Yeah, and initially what was, I guess, somewhat surprising, but probably not surprising when you look at just kind of the governor's approach to everything, was that he had initially stated that he would not, or that his administration would not issue a statewide mask mandate. He would, in fact, leave it up to the school districts. But it really just kind of seems like he didn't like the fact that a lot of school districts were saying we're going to leave it to the parents' discretion. So since he didn't get the result that he wanted, he, had the Secretary of Health issue made a declaration that is of questionable legal standing.
Right. So that's been their MO, though, Leo. That's been their MO the whole time, right? We're too dumb to know any better. I'm going to let you do it, providing you do what I want you to do. Well, you haven't.
Right.
And since you're too dumb to know how to take care of yourself, then I'm just going to intervene.
Right. And I mean, it's the absolute, really height of paternalism when it comes to government that, I know better than you do, and you're not making the decisions that I want you to. Right. And what's interesting is that we're not even seeing this. The mandate came actually after school had started, but there wasn't any evidence of increased transmission in any of the schools. There's no science. I mean, for somebody who claims to follow the science, there's really no scientific basis for it at all. It was just this is the decision that I'm going to make, so everyone is going to have to live with it.
Right. And all the schools had to submit a health and safety plan. It was just how they were going to mitigate the disease should they have outbreaks. And that's the other thing we're saying. The Secretary of Health, some of the lawsuits that have been filed say that she does not have the power to do this. It only gives her the power to intervene where there has been an outbreak. And so that makes more sense. And the schools have their health and safety plans so they can mitigate this. Because even, let's just say there is an outbreak in a school, right? Maybe it's just in one building, and so you shut down that building, or you require everybody that remains in that building to mask if the school district decides, that's how they want to mitigate this. But you wouldn't do it for the entire district, or you wouldn't do it for the entire state. Of course, you wouldn't do that. It wouldn't make any sense. So it's getting to the point where you're masking healthy people. You're controlling healthy people. You don't have, and so you're you're presumed guilty before, anything else.
Right.
You're subjecting people to testing. We have just, the Constitution wasn't written to say, except for if we think there's something really dangerous, except for if we think something is really concerning. No, the Constitution is the Constitution. You have these personal freedoms and rights.
Yeah, and really at the end of the day, that's what it boils down to. This isn't a position where it's interesting, because what ends up happening is people are automatically assuming the position where if you are opposed to a mask mandate or a vaccine mandate, that equals you are opposed to masks and vaccines, which is not at all what's being said. What's being said is that as an individual, you have a right to bodily autonomy. You get to make decisions about what you consume and how you take care of yourself, for better or worse. Where this is really becoming problematic is that this is completely erasing the individual's ability to make decisions on behalf of themselves. And we're seeing it pop up in really weird ways. I don't know if you saw this or not, but there's evidently down in Florida, there's a landlord, a property owner, who's basically saying, if you're, as a tenant, if you are not vaccinated, I'm essentially just going to kick you out. So, I mean, it's getting very bizarre. And it's really concerning, because we're going to develop into what is, essentially a two-tiered system for people who are willing to undergo, specific medical treatments, and for people who are, electing not to.
Right, and so that gets into your civil rights, right? You're creating two different classes, and I think that's what they're doing in schools as well. It's creating two different classes, and so what I don't understand with the vaccine, and I don't want to get too much in the weeds, is that so per the CDC, it's not stopping transmission. So why do you care if I'm vaccinated, right? And then you can make the choice if you want a mask. If you want to vaccinate, you can do that, right? You can choose to do that. I'm not stopping you from doing that. I'm saying it's not the best choice for me individually, because you don't know what my health situation is. You don't know the adverse reactions I may have to masking, or my children may have to masking, right? And then you get into, in schools, you have teachers calling out students not wearing masks. Would we call them out if they were in a wheelchair, right? Would we call them out if they were taking the elevators because of the stairs, no, you wouldn't, because it's discrimination, and you don't know,
Right.
and it's not, you don't have to disclose that personal information. And so we've just breached this line. We're allowing government, big tech, big pharma, and medicine to divide us up, right, and to pit us against one another. They're withholding information. We're not getting all of the information. I just got a couple calls over the weekend again, where I have hospitals who are documenting individuals that are in the hospital and being treated for COVID as unvaccinated because they don't have the booster yet. The booster is not even available for half these people, but they are declaring that those individuals are unvaccinated. So we're still not getting all of the complete information.
Yeah, and I think that it's challenging, because there are so many things that go into this kind of decision making for a person. I know that I actually just saw something come in. The FDA just approved one of the vaccines to be allowed on children. I mean, which is what it is. But the issue that we're constantly seeing, and the issue that is not being addressed, is how, by mandating something, you aren't actually providing an argument in favor of it, or actually it removes the government, the states, the need to convince someone. Essentially what it does is, rather than convincing someone, it allows for coercion, in that you are no longer able to participate in society in any meaningful way, or you may not be able to participate in society in a meaningful way because you are not getting a particular, medical procedure.
Right.
Kind of going back to the action that the health committee took, can you walk us through a little bit what is and I know it has a really long name, but the Committee on Documents and what is that? Like, who is it made up of? And this is not something prior to seeing this that I had ever heard of. I had to actually go back into the statutes and figure out what it was.
It's an appointed committee that oversees the Independent Regulatory Review Commission, and that's the commission that you have to submit your regulations and rules to that you want to implement, and then they go through a whole process. So this committee is made up of individuals from both sides, House, Senate, Governor's office, and then they would review what the process was, if the process was required for this action, and if the proper procedure followed. So they'll make a decision on that. Yes, and it's very seldom used.
Yeah, it sounds like it's not one of those things that we generally run into. I mean, partially because the regulatory process is fairly well spelled out in terms of these are the steps that you need to follow and what kind of regulations can be issued and the different actions that the House and the Senate can take. Is this so for the mask mandate that came out? Was this something that was also, did this have to go to the Independent Regulatory Review Commission as well, or is this just kind of the Department of Health issued this mandate and now?
So that's what we're saying should have gone there. The Secretary of Health, this mask order that she put through for all the schools, we're saying that needed to go through the regulatory review process. Okay. So that's the actual action that we're saying it would require her to do that, because it gives her control measures and it gives her the ability to intervene where there's been an outbreak. But it says control measures as the regulation and rule allow. And there are no regulations or rules that allow for universal masking in schools or in healthy people.
Right.
So we're saying that's the action that she should have gone through the process.
Yeah, and I think that taking a step back and looking at it and saying, okay, she did not follow the procedures. I think it's a great way to buy some time. But at the end of the day, I don't really see this as being a long-term solution, because she can, if she goes through the proper procedure for implementing the regulation, then the regulation takes effect anyway.
Well, she would have to go through that whole thing. It would have to be voted on. She would, and that is a pretty, extensive process. So you have stakeholders come in, they have the opportunity to weigh in on the rule or the regulation. So it is a little bit of a lengthy process, as it should be. But the other thing is in the law itself, it says, any of these mitigation efforts, or when a Secretary of Health intervenes, it has to be defined and it has to be limited in scope and duration. So it's not just like, here's a universal masking order and all your children will remain masked until, I don't know, we're going to just say, October 1. And then we're going to revisit it and we'll see. That's not how the rule is, or the law is written. And then just to take it back to when she shut down all the businesses using this same law. And we worked in York. My colleague Mike Jones worked with, started the Reopen PA in York County, and we had business owners kind of stick together who was going to remain open, and then providing legal counsel for them. Every single case that went before a judge, or that was where the Secretary of Health intervened or tried to sue the business for remaining open, either the Department of Health and the governor withdrew last minute, or the judge threw it out. Or it was ruled, like as in the case of Sicily, it was ruled in their favor, because it said the Secretary of Health does not have the power to come in and universally just levy an order where there has been no outbreak. So I think the precedent is there with businesses. All of those cases have been won.
Yeah, and I think that it's really important to look at that, because these legal protections, I mean, they have been put in place to prevent, in most cases, serious abuses of power by the state government. And what we're seeing is, the governor, and it's not just in Pennsylvania, it's nationally, at the state level and also at the federal level, where we have these just very broad edicts being issued without any regards to due process.
Right. And that's so, and then on top of this, so it was the Secretary of Health who issued this order to all the schools. And that was after the governor said, I'm going to give you all, let you make decisions that are appropriate for your school districts. Then it was the Department of Education that wrote these frequently asked questions or guidance for Secretary of Health's order. So why is the Secretary of Education writing guidance for the Secretary of Health's orders? Okay, number one. So, and now the Secretary of Health and all of his little minions are using these guidance, frequently asked questions, as leverage over school districts, threatening them. They don't abide by these guidance, not the rule itself, which the rule is pretty broad, and it's poorly written, quite frankly. It's even missing down to the fact of, or the point of numbering. It's not even numbered accurately. It misses a couple of numbers here and there. But if they wanted to add more to it or to tighten up, go back and amend the order, but they're not, because I know they're already on thin ice. They know they're already on thin ice on this. So how they're doing it is they're circumventing that. The Department of Ed is using their guidance to threaten and bully school districts to the point of failing to comply with the order. You could be now exposing yourself to personal liability. You would lose that sovereign immunity. That's what they're threatening them with. They're also saying some insurance companies, are looking at your policies and are considering withdrawing your coverage because you're not complying with the law. And these schools are complying. They were allowing an exception process as the actual rule allows. They're getting in the weeds with this. They come through. The IU wrote an opinion, and IU is the intermediate units. So around here, it's the capital area intermediate unit or Lincoln area intermediate unit. So they're working in tandem with the Department of Health so that we can make sure we have all these school boards scared to do anything, because they could be sued as a district and personally. And even if there's no merit there personally, what they're scaring them with is, well, there may not be a case. However, you have to spend money to defend yourself personally. It's shameful.
Yeah, it really is. That I'm not frequently at a loss for words, but this is a situation where I am definitely just. It's astonishing that this is the point that we're at, and we're looking at these things both in terms of the mask mandates and what's going on nationally with President Biden saying essentially anybody who is a federal contractor or who accepts federal money, the employees have to be vaccinated. We saw that the governor the state is being sued by the corrections department union, Union of Corrections Employees, over his mandate that was similar for employees that needed to be vaccinated if they were working in the prison system. We have the same thing happening within nursing homes. It is just, there is a tremendous amount of overreach that's taking place as it relates to this. And there's also a very substantial, amount of it's very untransparent. So it's really not clear what they're being used to make these decisions. We saw at the federal level that the president was actually, that President Biden and the CDC were actually working very closely with one of the national teachers unions in order to make their decision about masking and everything like that. I would be quite frank.
Leo, so it was just brought to my attention last week that our teachers union just sent out a survey to all their teachers asking what their position was on mandatory vaccinations for all children who are eligible to be vaccinated. So yeah, they're all working in tandem, not with the science, but with some kind of an agenda.
Yeah, and it's not something that is really the teachers unions in particular are, and when I say the teachers unions, generally, the leadership of the unions, who, the most of the teachers, although they technically have a choice whether or not they join a union, a lot of times practically, because the way the law is written, they are going to be financially supporting the union anyway. So it's not like there's a free market that they can go somewhere.
Right.
But one of the things that we're seeing is these organizations that have become allied with the left side of the political spectrum, are using their influence in order to influence public policy in ways, very obvious ways, that have nothing to do with
health and safety.
Yeah, with health and safety, or with the conditions of their workers. And I mean, it's really just it's horrific to sit back and watch.
And then and my other side of that too is saying, listen, if you want people to follow your recommendations and follow your guidance, right, then be honest and transparent and provide us all of the information and the data. So, for example, when the Secretary of Health came out and issued this order, she claimed that there was this massive outbreak, and she used an example of 2 different school districts were shut down and, didn't have football games, no fans in the stand, lights were off, et cetera, et cetera. Well, that was not true. The one school, East Lanco, was not shut down, and in fact, they did have their football game, and the stands were full. And the other one, they had one confirmed case, and out of abundance of caution, they decided not to play their football game that week because it was one player that had contracted it. It was not contracted on school grounds, which demonstrates that they're handling it, right? And they have a case, they're following protocol, and they're handling it, and they're able to do that. But and somebody said, well, they tried to deflect and say, well, look what DeSantis is doing, whatever. I don't care. What I'm saying is, if the Secretary of Health wants us to believe her and wants us to follow the guidance, then be honest. When you're giving us those kind of, you're using this kind of scare tactics and giving us that kind of misinformation, then we're not trusting anything you say. And that's not helpful for anybody. But the other point of this is, why are we not providing people information about outpatient treatment too, and just prophylactically treating this? That's the biggest malfeasance case I see out there. Our hospitals wouldn't be a fraction of what they are with COVID patients if we would just, hey, if you test positive, here's an outpatient therapy for you. It's pretty inexpensive. It's easy. Let's nip some of this in the bud. There's many different therapeutic drugs that work out there for this. We're not doing that. We're turning a blind eye and just saying, okay, go home, self-treat, fluids and rest. And, if you can't breathe, then go to emergency room. We've never done this with any other kind of disease in history. It's criminal.
Yeah. And I mean, so what CAP has done, and I mean, typically our focus has really just been on like economic policy and things like
Right.
that. One of the things that we did was, I mean, this is the first time that we've taken a position on something like this, just because it is so broad and overreaching. This morning we officially launched we launched a petition to try and gather as many people in one place as we can, so that as things like this, as news occurs, or as there are items up for consideration in the General Assembly by the governor, we have the ability to very quickly activate people and let them know what's going on. I mean, there has just been a tremendous amount of misinformation out there from the governor. There's been it's been an untransparent process. It's been horrific to watch unfold.
And while you guys do take economic, you try to stay on that economic track, I think this is economic, because the impact that this has had on our labor force, the impact it's
Right.
had on our supply chain, and the impact that it has had on our labor force hitting our bottom line, right? We have people closing, we have businesses closing at 5 o'clock because they don't have people. We have businesses closed for the day because they don't have staff. So for a myriad of reasons, this is impacted everywhere, and it is crushing our economy. It's crushing it.
Yeah, and realistically, we're seeing the the folks who are the least impacted or the least affected by this, at least, are really your major corporations, whereas
The
the
small guys
small
can't do it.
businesses, yeah, the small business mom and pop shops are the ones who really are not able to absorb the additional costs. But
Yep,
also they don't have the money to hire a legal team to try and navigate some of these regulations. So
absolutely.
for people who claim to be opposed to major corporations and the corporate greed and things like that, they are certainly creating an environment where it's impossible for small businesses and entrepreneurs to be successful.
Right. And look at our initial shutdowns, right? Our initial shutdowns. Everybody had to shut down. So my little guys, they couldn't sell plants, but Lowe's could. My
Right.
bike shop had to be closed, but Walmart sell a bike. I mean, it has been from day one. We have hammered the small guys, and the large corporations have been thriving, and nobody backs eye. So all the time they're talking about, oh, corporate greed, and you just propelled it. You just propelled it.
Right. Yeah, they're definitely compounding the problem and making things much worse than what it needs to be.
Right.
I
Because your
know
small
that
guys will be overly cautious. They'll be overly
right.
cautious because, like you said, they can't afford the attorneys to fight this.
Yeah, and then the governor, didn't help matters by vetoing some fairly common sense legal protections that were passed in
Right.
order to limit liability, for folks who had been following the recommendations and things like that. I mean, it's really just been appallingly mishandled at every level. And if you have ever needed a case for decentralization, I mean, this is it. When you look at where the biggest mistakes have been made, it's been made at the federal level, it's been made at the state level. You see county governments and local governments really being the most responsive, or trying to be the most responsive to their populations, and it's really just been because they know the population, they know the people, they know the situation, and the federal and state government just really don't have a clue.
Right. Absolutely. Yeah, so I agree. We need to decentralize that, and we need to bring back and I'll tell you honestly, Leo, as you guys know, I mean, this governor's been impossible to work with. It's go it alone. There's no science. There's no reason. I mean, you just saw the Auditor General came out and said, hey, guess what? There was no true criteria for the business waivers to stay open. Shock of all shock. Like, we already knew all of that, right? So you had them coming out doing this. We need the checks and balances. And so I said, listen, let's not touch the budget. Don't touch the budget until we negotiate something in there that does not allow the discrimination of individuals based upon masking or the discrimination based upon vaccines. I mean, that has to be negotiated in there. We have nothing else to negotiate with this governor. Couldn't do it. I was told it was a deal breaker. There's no way they could get that language in there. I had been having a conversation since April. Wouldn't do it. That was one of my big sticking points. I said, I cannot support a budget if we're not going to go in there and get some wins for the people.
Yeah, the power of the purse at this point is really the only thing that the House and the Senate have, and it seems
we're not using
very
it
frequently.
At all.
Yeah, it's not being used, and it is particularly evident when we're talking about education, when we're talking about the colleges and universities that the state provides funding for, instituting mandates on students. It's just been it's really unfortunate that the General Assembly, and not every member of the General Assembly, but leadership has really been reluctant to use that power of the purse because, quite frankly, they're afraid of bad press rather than, being moved by what's good policy. They're more worried about the headlines.
Right.
And that's just.
And we funded schools. We funded schools with an all-time record. And guess what? Here's another shock. It's still not enough. It never will be enough, right? And so, when you start negotiating with yourself, you're going to lose. And that's what we seem to do every time.
Yeah. Well, thank you very much for coming on today. I know that you have a packed schedule and you are dealing with a slight case of laryngitis. So I appreciate you taking one for the team and hopping on today to talk a little bit about what's happening as it relates to mask mandates. I will definitely look forward to having you on again as the process, just kind of moves forward and we see what the committee on documents actually does and where things go from here. So thanks, Representative Keefer. Thank you, everybody who tuned in this morning. We hope you like the new look of the cap backgrounds and everything. We're doing some housekeeping as it relates to things, trying to freshen things up. So thanks everybody for tuning in again. And again, thanks Representative Keefer for joining us.
Thanks, Leo. Bye-bye.